Hey, Lifespans class, this is Dr. Ang. Happy to be here with you. Today, we are going to be reviewing chapters 15 and 16, and it's the physical and cognitive development of what stage? We are now in middle adulthood. So the next two chapters, 15 and 16, we're going to review that. You can also take a look at Harvey. You can see the PowerPoints and resources there, supplemental materials that you can find on Harvey. So if you pull up your PowerPoint, I'm going to first start with chapter 15. Again, physical and cognitive development, and the stage is middle adulthood. This is a stage that's somewhat lengthy, and it typically is from approximately 40 to 65 is the age range for middle adulthood. And it's kind of that interesting stage. A lot of things can happen during this stage, depending on your individual circumstances. So for middle adulthood, you can have aging parents, even death and dying, going through that of a parent. Excuse me. You can also have adult children that you're also caring for. And this is also the stage where maybe they've went off to college, maybe they have gotten married, and sometimes even those adult children will return back home. There's kind of an increase of that as well. Kind of, you have the empty nest, and then sometimes they return to the nest if life circumstances change things. So it's often referred to as the sandwich generation, which kind of makes sense. You're sandwiched in during age 40 to 65. You're sandwiched in between aging parents and then the dependents. So whatever the situation is for children, if there are, is what forms that sandwich generation. So there's a lot that goes on between age 40 and 65. Also for the young adult, we've mentioned that a lot of the choices that are made during that stage often now the consequences will come to that. So if it's been poor diet, there's been risky behaviors, whatever that might be, now we're going to start to see some of those complications emerge in middle adulthood. So we may get diagnosis, for example, of high blood pressure or diabetes or whatever the case may be. That diagnosis may be coming all while we're trying to care for an aging parent. And we're also trying to help our dependents or our children adapt to life and to be a contributing to society and successful young adult. So thus the sandwich generation. If we go on this slide, let's go to the next slide. Healthy lifestyle choices. It's important to remember you either use it or lose it principle, and that's going to be the case in middle adulthood. So if there are good habits formed, you're going to see the good consequences of that. And if there are poor habits that are formed, you'll see the results of that as well. So during this stage, that is going to be critical. So the importance of those choices, such as exercise, diet, and avoiding tobacco and drugs, continue to grow as we become older. And the results of those become more apparent. Those decisions either add or subtract years from one's life. And when you're in young adulthood, you don't, or even adolescence, you don't think much beyond that. But as you come into middle adulthood, things are going to kind of connect. You're going to connect the dots, and you're seeing that, yes, I'm either contributing to a long life, longevity, and healthy years, or I'm actually subtracting from that based on my choices. When you have a chance, look at the food pyramid that's published by the U.S. government. You can look at that on myplate.gov. You can look at any of those and kind of see, so you know what's the norm and what are the appropriate with guidelines for middle adulthood. Food pyramid is a wonderful tool to incorporate. You can focus on exercise as well as obviously the food groups, and knowing what is appropriate. Ideal diet is low in cholesterol, low in sodium, high in fiber, and low in sugar. That's typically going to be a healthy diet and the parameters for that. It's important to remember that our lifestyle has an enormous impact on our health and well-being. And some risks to health include, like we mentioned, poor diet, stress, smoking, tobacco, drinking, and excessive inactivity. This is the stage also that if there is a very sedentary lifestyle or a desk job, and you're assuming all these responsibilities for so many people around you, can kind of help even further contribute to the sedentary lifestyle that you may have during these years. So incorporating weight-bearing exercise and getting a physical routine that, although you're going to feel strapped for time, it's so important to get those habits in so that you can see that and contribute to more healthy years rather than subtracting from that. So this is the stage when you're going to be able to tell if certain people are aging well or if the problems continue to compile during this stage. So if you go to the next slide, you'll see and choose myplate.gov. This is a website that I want you to go to and see. This is broken down by ages, but specifically for the lecture today, take a close look between the ages of 40 to 65. You want to eat a healthy diet that is consists of fruit, vegetables, whole grains, fat-free or low-fat products. These are all going to be healthier choices, including protein foods such as poultry, fish, banana, eggs, nuts, and lean meats are also going to be important for this stage. Adults of all ages have different nutritional and physical activity needs as their lives and bodies change, and a strong and healthy body can provide many benefits as you age. Maintaining healthy habits is an important way to lower your risk for things such as cancer, diabetes, heart disease. All these things contribute. So it's like all the information that we've learned all along, okay, the light bulb comes on. This is why we need to actually be doing these. Take it from head knowledge to action. And a lot of times it's going to be difficult, just as a healthcare worker, when you have someone, a middle adult, come in between 40 and 65, and if their habits have been extreme one way, it's really hard to take someone in this stage and completely transform their habits. And a lot of times it has to be more drastic means of, now you've received a diagnosis and now you're finally going to, okay, I guess I do need to quit smoking. I do need to start exercising. I do need to watch what I eat. And although I've start the day for the last, factory worker, I've started every day for the last 20 years eating donuts and drinking a Mountain Dew. I go to fast food for lunch. And a lot of times I just grab something quick on the way home from work. And 1 or 2 times, this is not a big deal. But as you see in middle adulthood, if this has been your pattern for many years, now we're going to start seeing the consequences to that. Or the discipline on the other side, the contrary, the discipline if you have made fruits, vegetables, whole grains, proteins, lean meats, all of these things, and then made exercise a priority. We all have the same amount of time. And everyone can argue that you probably don't have enough time to prioritize working out or exercise. However, those who have made time should start to see the benefits. It's not to say that if you've had a healthy lifestyle, you won't endure any challenges. You certainly will at some point, but it just can make things a little less stressful and can certainly contribute to a healthy lifestyle. So exercise, as we've mentioned, in lifestyle changes, exercise may be one of the best things that a midlife adult can do regularly, and it keeps a muscle strong and helps to reduce stress levels, which is a key. Increases energy And it can help with bone density also by exercising. But the key here that I want you to remember for middle adulthood is the level of stress. We're wanting to manage stress. At all levels, stress is imperative, but it's kind of specific and very prominent for the middle adult. As I've mentioned, you're caring for so many people around you that it's something we've got to make sure that we keep on the forefront. And as a healthcare provider, if for those of us that are in healthcare, our message is going to be, you're doing a great job taking care of your aging parents and your children as they're maturing into young adults. But what are you doing for yourself? Or for the mom that has for so many years taken care of her kids and her husband, and now is facing high blood pressure or pre-diabetic, and because she hasn't programmed herself to take care of her own health and her own needs. So a lot of times it's some of that mental programming that it's okay to stop and to just take care of you. It generally in middle adulthood, we want to say if you take care of you, you then are going to be better equipped to take care of others and those around you. So exercise, again, making sure that you know increased exercise is going to help decrease stress. So increase exercise, decrease stress. Also helps with bone density, and it's been proven exercising also will increase energy levels. So another benefit. So middle adulthood, 40 to 60. Again, some of the things that you can see shrinking, settling in. That's more of sometimes you can actually decrease an inch or so as you go into middle adulthood. Another thing that exercise will help with. Increase in the amount of body fat is generally found during this stage. Again, sedentary, health habits are evident, is what we're speaking of. Process in which the bones attached to the spinal column, they become less dense, the density, again, exercise with this. Women are more prone to decline in height due to osteoporosis. So this is another area that we're going to want to monitor specifically in women. Both men and women continue to gain weight into middle adulthood. So all of these that we're mentioning here, including the stress and decrease in energy, can be addressed with the simple fact of not having such a sedentary lifestyle and increasing exercise, in addition and in combination to a proper diet. Okay. Vision and hearing reaction time. Most middle adults experience fairly good health. So you're thinking, 40-year-old, that's still, you're feeling like you're in your prime. The risk of chronic disability is relatively low. However, changes in vision become farsighted or nearsighted, or both are very common. This will start to emerge. Someone that's had perfect eyesight, this will start to emerge in their 40s generally. Can be easily corrected with glasses or contacts generally. Some middle adults may experience hearing loss or slight hearing loss. This is also accompanied by, depending on what you've done for a profession, because again, now that once you hit 40 and 50, whatever you've done for an occupation, now you've been doing it for several years. So there will be some repercussions of that if there's been any risk factors that you've been exposed to or subject to. And vision in middle adulthood declines depth perception, distance perception, three-dimensional viewing, and then night vision. These are all, they become increasingly as you age, but they are start to be apparent in middle adulthood. Glaucoma, which is a condition in which there's pressure in the fluid of the eye, when that starts to increase, that's known as glaucoma. And then loss of ability to hear sounds of high frequency, and also depending on, again, what you've done for a profession. There are some professions where you may be around loud noises. There are some let's say you were in a concert setting, you were in around aircraft, different things that there's loud sounds, this can actually start to see your hearing decreasing, and it'll start with high frequency sounds will decrease first, and this is also seen in middle adulthood. Reaction time is also one. This tends to be more towards the end of middle adulthood, but reflexes, and again, when you think about the ones that we just mentioned, that's going to also, one area that would affect would be driving, specifically at night. So if you're having slight issues that are decreasing, or they're actually increasing in vision, and then reaction time, these are when you're probably going to feel safer not driving at night. And again, this is typically going to be the end of middle adulthood, but just something that we start to see slowly emerge in middle adulthood nevertheless. How does the climatic effect of sexual expression, how does that come into play? So sex in middle adulthood, it does affect reproduction in females, but physical intimacy is still very important, and it's important in middle adults to remember that they will also, you're kind of not as much focused on the childbearing years, but the sexual health is also very important to someone in middle adulthood. But also, now we're not thinking of maybe the childbearing years of trying to become pregnant, but now we're thinking more towards, we still need to practice safe sexual habits and a lifestyle. So frequency may decline, but sexual activities remain a vital part of life. You're also entering in menopause will come during this stage as well. So there are many changes. However, it's important to note this is still a very important aspect of life during middle adulthood. 150,000 American women per month enter into the stage of menopause. A menopause woman is less worried about the responsibility of assisting others and now wants to address her own needs. So again, this is what I was mentioning. This is the mom that for 20 something years I have taken care of my children. And then now, once they're leaving and I'm kind of entering empty nesting, now I realize I have needs that need to be addressed. And if you've put your female health on the back burner while you cared for your children, and then coupled that with the complexity of now I'm caring for my aging parents, you can see that the female health during this stage can decline if it's not made a priority. And some women will readily grab a hold of this and take the bull by the horns, if you will, for their health, and then others will have to be encouraged by a healthcare worker, or it'll end up in they're forced to do this through a diagnosis, and that will prompt them. So trying to get to that point before there's a diagnosis is always the best effort. But during midlife, women go through this climatic event, or the stage of menopause, and this is triggered by a loss of estrogen. So once that starts to decrease, and this is the stage that we often refer to as menopause. Usually starts by the mid-40s, possibly late 40s. Most is completed by the mid-50s, and it's typically finished by 58. By the time you're 60, then it's obviously finished by that point. But let's see, other changes that a woman may or may not experience. This is when you're going to know, you'll hear of hot flashes, night sweats. There's less lubricant may also be a factor. Clinically is defined as going for a year without a menstrual cycle. That's how we're going to know once you've went through menopause, is a year without a menstrual cycle. And at this stage, then the female is known to be past the reproductive years. Okay. Let's see. So hormone replacement therapy. This is very subjective. Some women will opt for this while others will not. Psychological consequences of menopause. Some women will view this as, thank goodness I'm through that stage of my life, while others will actually kind of grieve this process, depending on how you feel about it. And it's, as a healthcare worker, it's important for us to educate and help and support and make sure that this is have the optimal results as they transition through different stages of their life. Also making sure that females that they are connected in other areas, because a lot of times we see with this also that many times females' identity is wrapped up in their kids, and being able to kind of encourage, this is when it's good to encourage other interests or hobbies, or maybe a part-time job, maybe volunteering, where you can get the focus that it's okay to focus on females, because oftentimes the childbearing years are what become the identity of many females. So watching out for that, because there can be some mental health concerns that we want to think that could brew up during these stages as well. So making sure that they're either, if they're single or if they're not, that there's a supportive partner in that relationship, and letting them know there's resources if there is not. So NIMH studies found that perimenopausal women have 14 times the normal risk of depression. The transition through perimenopause can be a time of vulnerability, mood instability, irritability because of the brain's changes in estrogen and stress sensitivity. So we mentioned that there's going to be a decrease in estrogen. And with that, we know with the hormones, as they change, then we need to make sure that they are that we are aware of that can change, and that there is a risk of depression during that time. So making sure there's a supportive support and resources in place. You can look at additional research, not as critical for the exam, but more as a nice to know, and not as much a need to know as you look through these. Physical and psychological changes occur late in middle adulthood, around in their 50s. Testosterone and sperm will decrease, and 10% of prostate enlargement at this age, and 50% by entering into the 80s, and that's andropause. So men go through a comparable event, not the menopause, and not as a dramatic of a event, but they do, where there are changes as well for the males. And there's such a thing as andropause, and they do not lose the reproductive ability, although their sperm count will lower with age, and testosterone levels they will begin to diminish, which then is also associated then with reproduction. But they do not, it's not the same as menopause, that once you've gone through that year without any menstrual cycles and you went through menopause, then now the female has lost the ability for reproduction, whereas the males does not. The testosterone will slowly go down, but they still, and obviously this is subjective, each individual would be different, but this slide just indicates the male aspect. Health issues, worries of adulthood. You can look at some page numbers here that are of interest. Arthritis, diabetes, and hypertension. Screening and prevention of guidelines for older adults. You can see the page there. And as well as cancer. And typically risks increase as age increases. So kind of keep that in mind. Cardiovascular health may become of concern. Blood vessels lose their elasticity, and then they become thicker. So when they're not as elasticity, we can get higher risk for cardiovascular disease. Cholesterol levels will increase. Cardiac output will decrease. So it makes it sense, as we're not as pliable, we're not as flexible, and we're stiffening. That is going to produce a cardiac output that will decrease, and they may also tighten, not allowing as much flow through. Knowing the warning signs and early treatment is imperative for any one of the diseases, so education is going to be critical. Screening and prevention is imperative. Encourage adults to seek routine health care. Anything that you're going to receive, if it's heart disease, if it's diabetes, if it's cancer, early detection is key. So prevention obviously is the best. So think about it, if you started making wise choices in your 20s, where you're going to be when you're in your 50s, versus if you had risky behaviors, tobacco, alcohol misuse, prescription or non-prescription drugs, whatever the case may be. It's going to be much different if you've done that for the past several years. Routine health care is critical because that's an accountability checkpoint that can help. And early detection is going to be key. Being able to treat and manage any condition is obviously better the earlier that it's detected. And typically that's going to be with routine health care. So the lower a family's income, the more likely it is that a member will experience a disabling illness. So if you're thinking lower family income, you're thinking maybe they don't have health insurance, they may not have any coverage, they may not have reliable transportation, they may be holding down a job where they don't have the flexibility to go and obtain health care. Accidents and health hazards related to lower levels of income as well. If something's broken, not always can we fix it. Maybe there is a sidewalk that needs to be repaired. There's tripping hazards. There are cords or heaters that are brought in that potentially can cause harm, or fires, or things that are potentially dangerous that lower incomes also. When you think of it, there's limited, if there are limited resources, financial, for example, you're probably going to get as much food as you can for the amount of money that you can. This may not be someone, if you're on a very, very tight fixed income, and this can relate to any age group, you're going to probably buy the types of food that you can get the most for your money, and the things that will have the longest shelf life, which tend to be not the healthiest options. Gender illness among middle-aged women is higher than men. So illness among middle-aged women is higher than men. Direct psychological effects engage in harmful behaviors, indirect health related behaviors. So as we've mentioned, stress is key at this stage, can result from being the center of the family between aging parents and children, and then now grandchildren we're going to add. Some may be burdened with financial aspects of, you're still supporting your kids, and then now all of a sudden you're supporting your parents. Not only financial, but your time as well can just boost the stress up during this stage. Middle-aged adults can experience stress from a variety of sources. Physical changes that accompany middle adulthood can be a major source of stress for both men and women. They come to the realization that they are no longer in the prime of their life. And as you transition through that, as we've mentioned, that can lead some to depression, while others are like, this is great. Now I don't have a lot of people inside of my home. And some people transition very different. Now I can focus on me, and my spouse and I can travel, we can do whatever. It just depends on the circumstances and how tight they are in that sandwich generation, and how much pressures and outside pressure are forcing in on the individual. So middle-aged adults may deal with stress related to parenting their children, providing for their family, caring for the aging parents. Regardless of the source of stress, the consequences are very similar. So it doesn't matter where your stress comes from, but its effects on your body are going to be relatively similar. Psychologically, blood pressure tends to rise, while the immune system will decrease. And that's when you can get feeling sick based on stress. Behaviorally, stress generally leads to unhealthy choices. It can lead to smoking. It can lead to drinking, drugs, poor sleep habits. All these things are not necessarily what someone might choose, but when given a certain level of stress, it may be an area that they turn to, which will have its own implications and consequences. Heart-related disease, 200,000 people under the age of 65 die from heart disease. Risk factors, genetic, sex, age, environmental, and lifestyle choices. And I'll go back to the first one. These are people under 65. These are often people that may not have been following routine healthcare. They maybe didn't realize that they had heart disease until it was too late. Type A personality sometimes is linked to this. This may scare some of y'all, but if you're type A and you're wound really, really tight, you get results, you get a lot done. You're probably not missing appointments. You're probably taking somewhat good care of yourself. But if you let that personality type enter into a tight level of stress, that can have the psychological effects on your body and what physiological effects, as we've mentioned. Poor sleep habits. This is going to, it increases your blood pressure. It'll decrease immunity. So knowing that and just being self-aware if that's your personality type. So let's see. You can see I have a couple slides there to see type A, competitive, time urgent, can be more of an aggressive personality. Type B is more relaxed, patient, and easygoing. So you can see the little cartoon there, decide which you are. Cognitive development, IQ, fluid intelligence, crystallized intelligence, and changes. Turn your attention to the cognitive development. So to revisit formal and post-formal thought during midlife, and focus on some cognitive abilities that are enhanced in midlife. Remember, formal operational thought, that is the ability to think abstractly about any area. And although many adults have formal operational thought, it changes, and they don't have the ability when thinking about, multiple things. It kind of it will kind of just simplify during this stage. And the sciato, as we've mentioned before, the study that indicates that sleep declines in intelligence usually only start at around 60, and only, perceptual speed decline around 60 as well. So these are things where you're going to see people working crossword puzzles, different things, the whole use it or lose it mentality. Again, maybe for your job, you're starting to go on the decline. Now you've proved yourself, you're more in coast mode, maybe at work, and you're not pushing yourself to the point you did. So that may be a good thing. Or you're maybe even approaching retirement, or things where you had to do a lot of schoolwork where you helped one of your children, and now you're thinking you're not using your cognitive skills to the same level. So it's important for the in midlife that you engage in something that is stimulating the cognitive centers in your brain. The theory of fluid and crystallized intelligence proposes that there are two distinct kinds of intelligence. Fluid intelligence refers to the ability to reason and solve problems. So that's fluid. While crystallized intelligence will refer to the ability to use knowledge acquired through past learning or experiences. So crystallized, it's just kind of formed from the past. And then fluid, it's going to be problem solving in the moment. Here we talked about SCIA in inductive reasoning, spatial orientation, perceptual speed, verbal memory begin to decline. This is crazy, okay? Pay attention to this. Around 25, this starts to slowly decline. Numeric ability increases until your 40s, and then it lowers by about 60. Verbal ability rises until about 40, and then that usually stays somewhat steady. So verbal abilities. Crossword puzzles, again, that is the rock at this stage, and they help to maintain high cognitive thinking. So that's a good thing to remember. Whether you're reading, whatever the case may be at this stage, you want to stimulate that. So if I have a patient and I'm caring for someone, I may ask them, do they want a book? Do they want a crossword puzzle? Do they want something to stimulate their brain? Older adults seem to approach learning too. So if we have I've been in different programs where I've taught nursing, where we'll have someone that goes and does a career for several years and then they come back to nursing. They learn in a way very different than younger students. In fact, there's a particular type of teaching that addresses adult students. Andragogy is what's the difference, as you can imagine. Through an experience, is the adult is more interested in the relevance of the material being learned rather than relying on just memorization. So for an older adult, they're going to want to know, why am I learning this, and the meaning behind it, and I'm trying to connect the dots. Whereas a younger learner may still, like you're coming out of high school, you may still be in that mode of, I just need to memorize for the sake of learning it for the test, and then I'm going to let it fly away. But for an adult, especially as you went through college, you realize this information is building because I'm going to use this in my career path. Therefore, these dots need to all connect in order for me to produce something meaningful with this learning experience. Okay, professional success, cognitive decline. You can look at a study here in selective optimization, the process by which people concentrate on particular skill areas to compensate for losses in other areas. So you may get a male approaching 50, and they're going to work really, really, really hard and put more and more effort into what they're doing at work because they feel like, okay, I always coached my son's little league team, and now he's in high school and he's about to go off to college, and my identity was being his coach. I feel like I'm losing control of this. I went to the doctor. They told me I have high blood pressure. Then I went and found out I need to get glasses for the first time in my life. Now I feel like my health is of a concern. I'm losing something I felt very passionate about as a coach. And so what I'm going to do is I'm going to pour everything I've got into my work or my profession. We see that a lot, sometimes more often in males. It's established that younger adults outperform older adults on a wide range of cognitive tests, including perception, comparison speed, verbal memory, and spatial memory. But there's a study that concluded that it seems reasonable to expect that an older age would be at a disadvantage for a complex skill. This is the case of learning new skills simultaneously. However, the advanced knowledge base and expertise lends itself to the middle adult. So whereas you may put a 25-year-old next to a 55-year-old and give them a new task, and probably the 25-year-old is going to be able to complete that task at a faster rate, possibly. But this study is saying, that 55-year-old is going to have possibly more experience to pull from to make them where they may be better. They may not be as fast with it, but they're going to come with a lot of experience where they may have maybe a better way to do it. I've tried this several ways, and now I'm based on my experience, I'm going to do it this way, and it may prove to be beneficial, and that's where they'd have the edge on the 25-year-old based off of their experience. Expertise, acquisition of skill or knowledge in a particular area, that's your expertise. Development of expertise. Experts in their fields rely on experience and intuition based on all the years that they put into it. So that kind of makes sense. Midlife is sometimes considered to be a time of gaining expertise. So it's that pool they've put into that year after year after year. And now there's a beautiful pool of expertise that if younger workers are smart, they're going to tap into that and they're going to acknowledge that and not come in and say, this is the way we're going to do it, but tell me about how you do it. Tell me about your experience with this. And they're going to try to learn from someone with that expertise. The expert and the novice are different. Keep in mind that the expertise and experience have value. The expert seems to automatically know how to handle a situation, almost as if they know because of just basic intuition. That's how it comes out, is they can't even explain it. It's just based off of their experience. So memory type, short term is minutes or days. So short term memory consists of minutes or days. Long term is going to be more months or years. There's a fun little exercise on here. If you want to learn strategies for remembering things, you can look at that. So that is all for chapter 15. And if you have any questions whatsoever, please reach out to me. There are, I do have a TED Talk that kind of goes over memory. And this is something that's just kind of neat to see the YouTube right there. Because this is also helpful. Have an exercise that we sometimes do in class that just helps you to remember different ways that you can remember things. It's for an exam. It's for keeping that in your bank for NCLEX, and then also once you're a nurse and you're out actually working in your profession, how can you keep certain, form those structures of where you can keep certain concepts new and fresh that you can pull back from at a later date. But we will end 15 here. If you have any questions, please reach out.